Okay, moving on to particular topics regarding chronic illness and my experience with those. So, I sorted these into biological aspects, psychological, and sociological aspects um, to kind of make it easier as far as organizing topics. So, first of all, the biological um, access to care. I would say that my access to care has generally been very good. Um, but at the same time, it's complicated because when you have an LVAD, you have a heart team, and that team is centrally located in one location. So I was in southern Indiana in Evansville, and I could have chosen St. Louis, Louisville, Cincinnati, or Indianapolis. And I chose Indianapolis, well, because that's where I went for the emergency heart surgery. And I have a really good team. Uh, so I trust them and I want to stay with them. Locally, though, they don't really get it because it's more of a rare condition. It's becoming more and more common as people um, continue to have heart issues and get worse and worse. But, like, your average primary care doctor in Evansville isn't going to know how to treat an LVAD or how to maintain that. They're going to leave that up to the cardiology team. As far as transitions in care, that has been okay. Um, I guess I don't really know how to speak to that because I would need to know what transitions in care was referring to, whether that's transition from the hospital to a SNF or a rehabilitation state to outpatient to maintenance. So I don't really know about that. Palliative care, so I do have an advance directive. I do have a living will. You learn a lot about that stuff whenever you have a life-threatening chronic illness. Generally, I find that the people in the palliative care know their stuff and are in that setting because they are good at their jobs and are good at not pushing you into decisions that you wouldn't make otherwise. So they're very good in that aspect. I guess palliative care, in my opinion, seems to be, it doesn't really know what it wants to be right now. So it's a step above hospice in that you're not dying, but you feel like it, and we're going to try to make that better. So there's that, and then there's symptom management, which they do, but it's like you really need to find your niche and figure out what a particular hospital's palliative care services can do for you and take advantage of those. There really isn't a great uniformity across the United States in what palliative care is, that I know of. So, symptom management, pain management, well, when you're in the hospital right out of surgery, you're pretty hard on opiates and analgesics. Then they wean you off of those. They get you to tabs instead of IV. And when you're at home recovering, you usually have hydrocodone, acetaminophen. You might have Lortabs or a muscle relaxer, but generally they're given with the suggestion that try to get through your pain and take this as sparingly as you can, but also don't not take the medication. So it's a thin line nowadays, and I think they do a pretty good job about understanding where you are at your pain level and what you can do about it. Patient is expert versus having a medical expert. I'm a little bit biased in this, that on both parts, really. Patient is expert. I always think back to my experience with that ER doctor and how he kept saying, it's this, and I know what it is, and you don't, and here's the medicine, and get out of my ER. And maybe I was just dealing with a really bad doctor, but at the same time, he didn't listen to me. He didn't listen to my symptoms, and just the first thing that popped into his head is what he went with. And it ended up really detrimental to my life. So, looking back at that, he could have benefited a whole lot from just stopping, listening, and getting the patient's point of view as if they are an expert on their own experience, because they are. On the reverse side of that, don't think that a patient knows what a medical doctor knows or should know. So I was recently frustrated when my doctors wanted me to decide, do you want to stay on the transplant list or not? And had not given me their professional opinions or data. And I think that's when they kind of lean too far towards the patient as the expert or as the agent in their healthcare, because I don't know the stats. I don't know the most recent studies on what I should consider and what is the best option medically. In my opinion, it's their job to inform me of their just really superior knowledge on the subject so that I can make an informed decision on my behalf, if that makes sense. Lastly, polypharmacy. So I haven't had a lot of problems with this, I don't think. I take about 12, maybe 13 different medications in a day. A lot of those are supplements. But I guess I don't really know. Personally, if you ask your doctors if there's a medication that you can go off of, I guess what I'm trying to say is work with your doctors about your concerns with polypharmacy. But to do that, you have to be informed that polypharmacy is something that doctors are want to do and is something that you as a patient need to look out for and be aware of.